The second problem we see after surgery, or for that matter after any form of treatment for prostate cancer, is erection problems. What's an erection problem? An erection problem is where the man is unable to get an erection sufficient for penetration. The likelihood of this happening depends on many factors. It depends on the experience of the surgeon. It depends on how your erections were before the operation. It depends on how many nerves were able to be spared, and that of course is related to what type of cancer you've got. It relates to how long after the surgery you care to make that assessment, because it often takes a year or two for full recovery, or for partial recovery for that matter. So there are many factors that influence the likelihood of erection problems. It's true that the younger you are, the better your erections beforehand, the more experienced your surgeon, and the more nerves that are spared, the better your outcome from sexual recovery is going to be. One of the things I always tell my patients is to realise that it can be a long recovery between surgery and erection recovery. We've even seen people recover their erections up to 4 years after the surgery. But the vast majority recover their erections, if they're going to recover them, within 18 months. When it comes to sexual recovery after surgery, it's important to realise, as I mentioned before, it can take quite a long time. And often the erections don't recover to exactly the hardness they used to be before the operation. However, it's also important to understand that a rehabilitation program commenced soon after the surgery can improve the chance of recovery of erections. And finally, it's important that your partner is supportive in this rehabilitation program, because without your partner, the results are not as good, and the support and the emotional support and the psychological factors start to come into play. So involve your partner, start your rehabilitation early, and make sure that you use it, otherwise you might lose it. So what is this rehabilitation program? What is this penile rehabilitation program? What it really means is trying to get the penis to work again as it did before the operation. How do we do that? How do we improve the chance of that occurring? Well, the way we do that is by trying to use it rather than losing it. So doing it, whatever it is, as frequently as possible, but also to perhaps use medications such as Cialis, Viagra or Levitra at a very low dose on a regular basis to try and make sure there's a slightly better blood supply to the penis so that it responds better in the passage of time. This may be like an insurance policy for a better erection recovery down the track. So which medication should you use for penile rehabilitation? It's been my practice to use 5 milligrams of Cialis every day, and once a month a higher dose of 20 milligrams of Cialis. Some people can't take Cialis, in which case I use the other tablets such as Levitra or Viagra. All of them are very similar. So what is involved in the penile rehabilitation program? I prefer to use a regular medication, either Cialis, Levitra or Viagra, at a very low dose to improve the chance of erection recovery, and every so often, maybe every month, a bigger dose to attempt penetrative intercourse. By doing that, and over time, we notice gradual improvement, sometimes quite dramatic improvement, and of course, once things have recovered, you gradually wean that out. In some cases, people want a quicker fix. They want penetration much earlier in the penile rehabilitation program, and for those people, injections or vacuum devices, often with the aid of a sexual health physician, can successfully achieve those goals. I'm often asked, which is the best treatment to minimise the chance of penile or sexual problems? As we stand at the moment, the best information we have is that low dose rate brachytherapy or seed therapy has the least chance of causing erection problems, with the trade-off that it's probably got a slightly lower cure rate and it can only be used in certain types of cancers. So yes, it's an excellent treatment to minimise sexual side effects, but no, it's not for everybody. So if you do have a cancer that's best treated with surgery, how can you minimise the chance of sexual problems? Well, the way to do that is to obviously choose a good nerve-sparing surgeon with good results, who can protect the nerves, even in some cases with slightly more advanced cancers. And that way, you'll improve your chance of erections recovering. So what other aspects of sexual function can be affected? Well, it's not just erections. It's confidence. There can be psychological issues. And we all need to remember that when you take a prostate out or irradiate it, we stop the source of fluid which comes out with ejaculation. So you have a dry ejaculate. In other words, at the time of orgasm, there's no fluid. That's a given, and that goes for everybody. It's also important to realise that orgasm, according to most of my patients, are reasonably well preserved, even in the absence of a full erection. So one of the good things to remember is that pleasuring can continue as it was before. What are the other side effects we see with different treatments? What are the other sexual side effects we see with different treatments? Concerns I get from some of my patients is that their penis length is slightly shorter. One of the other consequences of surgery is the possibility of a shorter penis. Whilst this, of course, is what nobody wants, the shortening, fortunately, is relatively minimal, and in an active rehabilitation program, this can be minimised. Another question that I'm often asked is the type of surgery going to give me different sexual outcomes? In other words, if I have it done robotically or open, or for that matter laparoscopically, am I going to get better or worse sexual outcomes? As we stand at the moment, it appears to be very similar in very experienced hands. The emphasis here is on experience at nerve sparing, no matter what the technology. There is early evidence that the robotic experts have slightly better sexual outcomes than the open experts, but this is very preliminary and by no means proven at this stage. After radical prostatectomy or radiotherapy or high-dose rate brachytherapy or brachytherapy, all of the treatment options are available. That is to say, we can use medications such as Viagra, Cialis or Levitra. We can use injections. We can use different forms of vacuum devices. And if all else fails, we can use a penile implant. I strongly suggest that you use the full team to help you through this period if this is a big factor. A sexual health rehabilitation specialist is paramount to help you through this period to make sure you have your best shot at all these different treatments. And if necessary, you can certainly come back to your surgeon and consider the possibility of a penile implant if all else fails. You need to realise that the chance of a penile implant is very small. And you also need to realise that this tends to happen in an older group of people or in people with very aggressive cancers where unfortunately the nerves do have to be sacrificed. So in conclusion, sexual problems are not uncommon after surgery or radiotherapy options for prostate cancer. Many of them recover, but often it requires a careful rehabilitation program and a good understanding partner and a good understanding sexual health physician and urologist to help you through this period. It's important to realise that there are treatments at all stages, and they range from tablets to injections to vacuum devices to even a penile implant. Everybody's priorities are clearly different, but you need to understand that there is a treatment, and if you do want to continue to be sexually active, don't just give up. Ask your urologist, make sure that you understand what your treatment options are, and then make an informed decision.